hospital at the center of the coronavirus epidemic has died after contracting the disease. The 51-year-old neurosurgeon passing away overnight. The hospital releasing a statement saying in part, without regard to his personal safety, he led the medical staff of the Wuhan hospital at the front lines of the fight against the epidemic. It comes amid confusion in Cambodia after an American woman aboard this cruise ship, the Westerdam, tested positive for the coronavirus 2 days after she and hundreds of passengers were allowed to disembark and cleared for travel. Some 300 left the country after passing health screenings, scattering across the globe. She was diagnosed after landing in Malaysia. The news triggering
Americans exposed to the coronavirus are now back in the U.S., evacuated by the State Department from a cruise ship in Japan. Today, a top government scientist here in Washington says they were rescued because the quarantine on board the Diamond Princess failed. 14 of those Americans tested positive for the virus. Now, they were kept separate from the other passengers and are now being treated at U.S. hospitals, nearly doubling the number of Americans with coronavirus. The rest of those airlifted home are now in quarantine at U.S. military bases. Tonight, the number of cases worldwide now tops 73,000, with more than 1,800 deaths. Carter Evans leads off our coverage tonight.
Crews in protective suits greeted the Americans as the 2 charter flights landed in Texas and here at Travis Air Force Base in California. U.S. officials said the quarantine on the Diamond Princess in Japan had failed. 14 evacuees tested positive for the virus and had to be isolated from other passengers.
All right, careful, that's the smoke.
Many chronicled their journey on social media as they finally left the ship and boarded buses before flying.
We just landed, Carl and I, in Nebraska.
Jerry Cerati Goldman and her husband Carl were among those who traveled to Epley Airfield outside Omaha.
Clearly these were folks that had a high index of suspicion that came to us, and so all of them we knew that we would evaluate them.
This is our greeting team.
This was the scene at the base as they arrived. Goldman's husband developed respiratory symptoms in transit and is currently being tested.
I'm not able to leave this room at all.
She's being housed on a medical center campus. There is also concern about the more than 2,000 passengers and crew members who were aboard the cruise ship Westerdam. They disembarked in Cambodia and had been given the all clear, but an American woman who had been a passenger now has tested positive. And health officials in Hawaii are now tracing the contacts of a Japanese couple who vacationed in Maui and Honolulu. Both were diagnosed with the coronavirus after returning home. And the evacuees who just arrived here at Travis Air Force Base are now beginning their 14-day quarantine. Meanwhile, the effects of the coronavirus are spreading to the tech world, with Apple announcing today its quarterly earnings could be lower than expected because of a production cut in iPhones in China. Nora.
A viral economic effect. Thank you, Carter.
69, although there are indications that even if you get it, you can get it again, and the second time could even be worse. Total cases, as you can see here, it's going up on a linear scale, and it seems to be flattening out a little. There was a jump, which had a lot to do with the change in definitions, but the definitions have changed again. And the total deaths, as you can see, slightly flattening. But effective February 17th, confirmed cases include both laboratory confirmed as previously reported and clinically diagnosed, currently only applicable to Hubei province, China. This comes from the World Health Organization, so we are not comparing apples to apples when we are looking at day-to-day numbers. All right. So this is the big question. Did coronavirus originate in Chinese government laboratory? Scientists believe killer disease may have begun in research facility 300 yards from Wuhan wet fish market. A new bombshell paper from the Beijing-sponsored South China University of Technology says that the Wuhan Center for Disease Control could have spawned the contagion in Hubei province. Quote, the possible origins of 2019 nCoV coronavirus, penned by scholars Boto Zhao and Li Zhao, claims the WHCDC kept disease-ridden animals in laboratories, including 605 bats. It also mentions that bats, which are linked to coronavirus, once attacked a researcher and, quote, blood of bat was on his skin, The report says, quote, genome sequences from patients were 96 or 89% identical to the bat CoV ZC45 coronavirus originally found in Rhinolophus affinis, the intermediate horseshoe bat. It describes how the only native bats are found about 600 miles away from the Wuhan seafood market, and that the probability of bats flying from Yunnan and Zhejiang province was minimal. In addition, there is little to suggest the local populace eat the bats, as evidenced by testimonies of 31 residents and 28 visitors. Instead, the authors point to research being carried out within a few hundred yards at the WHCDC. Now, that's important. So if the native bats are 600 miles away, then the only way that bats would end up in the seafood market is if they were a very prized local delicacy, because you'd have to go 600 miles, or somebody would have to go 600 miles, catch the bats, ship them back in a way that kept them fresh. So if people aren't interested in eating bats, nobody's bringing bats from 600 miles away, if it's not a particular kind of delicacy, or I guess it could conceivably be that it would be used in traditional medicine. One of the researchers at the WHCDC described quarantining himself for 2 weeks after a bat's blood got on his skin, according to the report. The same man also quarantined himself after a bat urinated on him. And he also mentions discovering a live tick from a bat, parasites known for their ability to pass infections through a host animal's blood. The WHCDC was also adjacent to the Union Hospital, where the first group of doctors were infected during this epidemic, the report says. It is plausible, this is the report, that the virus leaked around and some of them contaminated the initial patients in this epidemic, though solid proofs are needed in future study. And as well as the WHCDC, the report suggests that the Wuhan Institute of Virology could also have leaked the virus, as has previously been reported by Mail Online. Quote, this laboratory reported that the Chinese horseshoe bats were natural reservoirs for the severe acute respiratory syndrome coronavirus, which caused the 2002-2003 pandemic. The principal investigator participated in a project which generated a chimeric virus using the SARS-CoV reverse genetic system and reported the potential for human emergence 10. A direct speculation was that SARS-CoV
confirmed cases in the coronavirus outbreak now nearing 73,000. The total death toll topping 1,800. In the U.S., there are 15 confirmed cases, with 8 of them in California. Meanwhile, in corporate America, Apple warning that the coronavirus will negatively impact the company's revenue guidance. Let's bring in Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases. Welcome back, Dr. Fauci. Thanks for joining us.
Good to be with you.
So what can you tell us right now about how long you expect many parts of the Chinese economy, business, people quarantined to be shut down?
You know, it's very difficult to tell, because what the Chinese have done is something that really is unprecedented. The degree with which they have shut down travel through major cities encompassing about 50 million people, including the entire 11 million person city of Wuhan, a big industrial hub, is really unprecedented. Their decision to do that was their desire to make sure that the virus does not spread further throughout China, but also outside of China into other countries. It might actually work, as unusual as such a move is to stop an outbreak. It looks like it might be slowing things down, but we don't know. They're saying that there are less new infections in the last couple of days, but I think we need to give it a few more days to determine if that's real or that's just the variability that you generally see.
Given, as you said, that it's such an unusual move that they took to try and contain the virus, if you did see a mini outbreak, hopefully we will not, but if you did see a mini outbreak here in the US, would it be harder to contain or now easier, given that we're on top of things, aware of what the disease is and how it's spread?
Well, it really depends on how the virus is introduced. For example, the 15 cases that we had, 13 of them are travel related and 2 are spouses of the travelers. We immediately identified them, isolated them, and did contact tracing. You get into trouble if people enter the country sort of under the radar screen who are infected, and then you get secondary